Welcome to HDTV. You now rocking with your boy. Well, in the New York Times, back on August 25th, 2020, article written by Catherine J. Wu, the CDC, which is the Center of Disease Control, now says people without COVID-19 symptoms do not need testing. The revision prompted confusion and alarm from experts who called the move potentially dangerous. One doctor says if people are getting exposed and they're not getting tested and they're not isolating, that's a huge problem, one doctor said. Excuse me. The Center for Disease Control and Prevention quietly modified its coronavirus testing guidelines this week to exclude people who do not have symptoms of COVID 19. Even if they have been recently exposed to the virus, experts question the revision, pointing to the importance of identifying infections in the small window immediately before the onset of symptoms. When many individuals appear to be most contagious, models suggest that about half of transmission events can be traced back to individuals still in this so-called pre-symptomatic stage, before they start to feel ill, if they ever feel sick at all. This is potentially dangerous, said Dr. Krutika Kapali, an infectious disease physician in Palo Alto, California. Restricting testing to only people with obvious symptoms of COVID-19 means you're not looking for a lot of people who are potential spreaders of disease, she added. I feel like this is going to make things worse. At a moment when experts have almost universally come forward to encourage more frequent and widespread testing, especially to reach vulnerable and marginalized sectors of the population, the CDC's update appears counterintuitive, and very strange, says Susan Butler Wu, a clinical microbiologist at the Keck School of Medicine of the University of Southern California. Just weeks ago, the National Institutes of Health announced the first round of grant recipients for its Rapid Acceleration of Diagnostics Program, or RADX, to scale up coronavirus testing in the coming weeks and months. On the agency's RADX website, officials underscore the importance of prioritizing tests that can detect people who are asymptomatic. A more lax approach to testing, experts said, could delay crucial treatments, as well as obscure or even hasten the coronavirus's spread in the community. I think it's bizarre, said Daniel Larimore, a mathematician and infectious disease modeler at the University of Colorado Boulder. Any move right now to reduce levels of testing by changing guidelines is a step in the wrong direction. Prior iterations of the CDC's testing guidelines struck a markedly different tone, explicitly stating that testing is recommended for all close contacts of people infected with the coronavirus, regardless of symptoms. The agency also specifically emphasized the potential for asymptomatic and pre-symptomatic transmission as an important factor in the spread of the virus. The newest version, which was posted on Monday, amended the agency's guidance to say that people who have been in close contact with an infected individual, typically defined as being within 6 feet of a person with the coronavirus and for at least 15 minutes, do not necessarily need a test if they do not have symptoms. Exceptions, the agency noted, might be made for vulnerable individuals or if health care providers or state or local public health officials recommend testing. Wow, that is a walk back, Dr. Butler Wu said. We're in the middle of a pandemic, and that's a really big change. Dr. Butler Wu said she was concerned that the guidelines would be misinterpreted as implying that people without symptoms were unable to pass the coronavirus on to others, a falsehood that experts had been trying for months to dispel. If people are getting exposed and they're not getting tested and they are not isolating, that's a huge problem, Dr. Kapala said. By the CDC's own estimates, roughly 40% of people infected with the coronavirus may never go on to develop symptoms, remaining asymptomatic for the duration of their tenure with the virus. These numbers are tentative and ironically can be confirmed without more testing of people who appear entirely healthy. Although researchers remain unsure how often asymptomatic people unwittingly transmit the coronavirus, studies have shown that the silent infected can carry the virus in high amounts. The evidence is more clear cut for pre-symptomatic people, in whom virus levels tend to peak just before illness sets in, a period when these individuals might be mingling with their peers, sending super spreader events. Notably, experts can't distinguish asymptomatic people from those who are pre-symptomatic until symptoms do or don't appear. It seems backwards to just ignore pre-symptomatic patients, Dr. Butler Wu said. David Piergaro, who lives in Trenton, New Jersey, has sought out several tests for the coronavirus in recent months. After events like funerals and those that require travel because of his post in the National Guard, he never experienced symptoms, and his tests have all been negative, bringing him peace of mind, especially because he lives with his parents and grandfather. I view testing as a good thing to do, he said. Asymptomatic people could be spreading the virus, so widespread testing seems valuable. Tracking an asymptomatic cases is also important from the perspective of the infected. Dr. Kapala said less than a year into this pandemic, experts still don't know the full extent of the long-term consequences of contracting the coronavirus, even if the initial encounter seems benign. The reasons behind the surprise shift in testing recommendations are unclear. In response to an inquiry from the New York Times, a representative for the CDC directed the question to the U.S. Department of Health and Human Services. An HHS spokesperson said that asymptomatic testing could still be warranted when directed by public health leaders or healthcare providers, and noted that testing decisions should be based on individual circumstances and the status of community spread. On Twitter, some people speculated that the Trump administration made the change to try to address continuing supply shortages, which have stymied testing efforts in many parts of the country, stretching turnaround times for results to weeks or more. Many institutions and companies performing testing have prioritized people with symptoms in their lineup as a way to expedite the return of results for those most at risk for falling severely ill. When asked about this, the HHS spokesperson said the modification was not a response to sputtering supply chains. Testing capacity has massively expanded, and we are not utilizing the full capacity that we have developed. The spokesperson said we revised the guidance to reflect current evidence and the best public health interventions. Poorly timed testing, if conducted infrequently, could lead to false positives or false negatives, mistaking healthy people as infected or vice versa. That's a potential risk if someone gets tested too soon after being exposed to the coronavirus, Dr. Butler Wu pointed out. Even so, anyone with a known exposure should quarantine and consider seeking a test, Dr. Kapali said, adding, we still need to be careful. Well, what do you think? Do you feel like the CDC is making the right call by saying if you don't have any symptoms, you don't need to be tested? Or what's their motives? So basically, when we look at the situation, it's you do need testing. You need testing whether you are healthy or not healthy. You need testing to basically see if you're functioning right. You have to also ask yourself this question: is the CDC cutting this because of the election coming up and everything? You want to have more drama added to it? Like what is it? To me, I go with the doctors, Kapali and the other doctor. You need testing to see what's going on. We don't know what this virus could do. This virus can mess around and turn around and come after those who don't have it. But they say that if you're asymptomatic, you basically can walk somewhere, give the disease to somebody you wouldn't even know. So to me, let me know in the comment section what you think. Do you believe that the CDC did this on purpose to try to follow what, try to do as Trump was asking them to do, or do you feel this is a dumb idea and that everyone should get tested? I'm going with this is a dumb idea that everybody should get tested. Now, I'm out. Um, like, comment, share, subscribe, share this page, please. Share it to everybody. Share it on your platforms, and like I said, like, comment, subscribe, and share this. Also, if you want to donate to the page, my Cash App is Harry Harry and the number 2 right next to it. It's Harry Harry and the number 2. Um, and basically, oh yeah, shout out to On the Mark with Tracy and Cliff. That's every Monday, I believe, on Facebook. From 5 to 9. I'm not sure. I'll try to get back with you guys. But yeah, basically, shoot, we're out. La boy.